Hello, everybody. This is our first Mindful Medicine MD, Mindful Medicine and Wellness MD podcast that's going to discuss East and West methods or methodology for treatment. And we hope to make this an ongoing program. And I'm sitting here with Dr. Lily Gerson, a
Hello.
trained MD from Jefferson University. We met a long time ago when I had a yoga school, and she flattered me with asking me if I would like to help come into her new direct primary care practice. So we're going to just try to answer some questions and try to make you more aware of our new kind of healing methodology.
Perfect. And yeah, Larry, I think this was like we were just saying, a little earlier, this was so needed. I think people are really craving this kind of concept, not just having doctors tell you you need this and here's your medicines and do this and, kind of work with the individual and, have a more holistic view. So I think what we're doing is going to be really special.
I'm thrilled. I'm honored.
Yeah. Yeah.
I hope we can make this podcast get it out to the world and help educate people and give them another perspective.
Perfect. So I think a lot of when I'm talking to my, patients who are used to seeing the traditional doctor, a lot of them, when I mentioned that I've partnered with you and you do the, Ayurveda, more holistic healing, they're like, what is Ayurveda? So, and you're like, just a broad general question, can you tell us a little bit about what it is and how it differs from the traditional Western medicine that, I do?
Yes. Well, first of all, Ayurveda accepts all healing modalities. So whatever can fix you the best, it's Ayurveda would accept that. So it's not that restrained. If you have a serious back issue or something, maybe your Ayurvedic practitioner would send you to a chiropractor, or anything medical that Ayurveda can't fix. They're happy to encourage you to go to an MD. But so what Ayurveda is, Ayurveda is a Sanskrit word. Ayur means life, and Veda means science in Sanskrit. And it's one of the oldest practiced healing modalities in the world. I forget the exact amount of years, but it's thousands and thousands of years. It's been practiced in India and still practiced in India, but it's become a little more country, like local, because in all due respect to the British, and I love the UK, they, through colonialism, they squashed it in India because they felt it was something that
Interesting.
was counter, it wasn't, they wanted control and they wanted their medicine. So they wanted people to come to them, practice the type of medicine, Western medicine that they believed. So it set Ayurveda back a lot. But
So you're saying now it's really only practiced in like the more rural areas of
no, it's coming back.
India?
It's
Okay.
really come back. But so when I forget when the revolution was, it was in the 40s, right? Um, so it began to flourish again in about 100 years ago. But for a long time under British rule, Ayurveda was squashed as
Okay.
quack stuff, and they made up all kinds of, some of it. And there's quackery in every alternative healing modality. But what basically Ayurveda is, it believes that everybody's body is different and individual.
Mhm.
And which is why, I mean, sometimes I have my brother-in-law is a clinical pharmacologist at Cornell. And he's always telling me that, yeah, the drugs work on half the people, half the time. And because so Ayurveda believes the reason for that is everybody's body is a little bit different and should be treated uniquely. And it breaks the
Yeah.
body down. This is where it gets a little trippy. So just stick with me. There's a philosophy called Sankhya, which says that everything in the universe is made up of the five elements: air, space, fire, water, and earth. And to make it a little bit easier, they took air and space and they made it into something called vata, which, excuse the Sanskrit, there's aren't a lot of better words, but we can call it winter because it means it's vata is cold and dry.
Okay.
And vata controls our electrical system in our body. So it's your heart stuff, it's your circulatory system. It's responsible for what goes wrong in your ears and a lot of what goes wrong in your gut. So the space part is the space inside. So the space in your ear canal, the space in your colon. So vata's, we treat vata, any type of colon issues, you would treat the vata. And vata's
Okay.
dry. So this is a game of opposites. You just oil it. It's like kind of basic. You're too cold, warm up. You're too warm, cool down. So the other one, so that's the first one, vata. Like I said, it lives in your colon. That's the place where it lives. It's synonymous kind of to the winter. So we could call it winter
Okay.
because it actually exacerbates in the wintertime.
Hmm.
When it gets dry, so it's kind of when I think about like the leaves falling off the trees, it's more vata. And then each
Okay.
one of the things besides having a season, there's the time of our life. So vata is like comes on stronger when you become a senior.
Okay.
So it begins to affect the mind. It begins to affect your skin. You start drying. Sadly, we dry up when we get, so um,
Interesting.
so the pitta, which we'll call it summer,
Okay.
is it's hot and wet. So it's the it's the fire and water elements.
Okay.
And pitta is responsible for all the digestive stuff. So it's the hydrochloric acid basically in your belly to try to digest things, and it's responsible. There's crossover vata too, but pitta controls a lot of digestion stuff. It also controls we treat the liver with pitta pacifying protocols because the liver is a pitta organ, and we're taught that the liver um, cleanses itself through the skin. So if there's so people, when they have skin stuff, we treat the liver, and we do that, with bitter herbs and different. So we can talk more about that, but um,
Okay.
how you would try to do that. And we're going to have a pitta yoga class because pitta is the summer. So we're going to do poses that concentrate on our middle. So we're
Okay.
going to do a lot of
Interesting.
twists, easier back bends, pulling breathing practice, because yoga ties into this and does certain breathing practice. So then kapha is the earth and water elements. And so pitta, I'm sorry, backtrack for a second. So pitta time of the year is the summer. The pitta time of life is like from the time you graduate high school, it's your career years. It's a
Okay.
fire,
Got
you
it.
know, it's when you're working hard and
Got it.
trying to really build stuff, which is why, it can mess up your stomach. And
Yeah. Interesting.
so
Okay.
so earth,
You know,
oh,
this is reminding me, your guru, who was an
yeah,
amazing person who I met, told me that I had a little bit of pitta in me, given that I'm, a physician and working hard, and I've got that fire in me. I was appreciative of that.
no, you definitely have pitta. But
Yeah.
when you begin to study this over the years, you begin to look at a person's face and their personality and listen to them talk. And you begin to, without just taking pulse, you begin to put it together.
Got it.
And so kapha, which basically translates as phlegm, um, is the earth and water elements in our body. And kapha is the spring when everything begins to melt. I think that we're taught kind of things begin to melt in your body. and you develop more moisture and you have more places in your body that can get infected. So you get a chest cold, you get different stuff, this warm, moist times where it's easier to have an infection. So kapha is like baby stuff, and it's round and gooey. And like when your kids are little, just leaky is like all the kapha. And so each one has personality attributes too. So kapha is like love. It's a little bit, kapha people are like a little bit lazier to get them off the couch. But once they get off the couch, they have real fight and work hard. They learn slowly, but they're like an elephant. They never forget. It's really interesting how, I mean, when you begin to look at this over.
And so are you these, and I think you call these constitutions, right? These are your constitutions.
Well, they call them dosha, which
dosha. Okay.
I prefer to call them constitutions because dosha in Sanskrit means spoilage. And I think it's a confusing word, but the world calls it dosha.
And are you able to change your doshas or constitutions in your lifetime, or are you born with one and that's kind of, because when you're saying, it's like a baby, and then when you get old, like I guess it can be fluid, or?
Well, each person has, that's a great question. Each person has, let me put it this way. So there's, excuse the two more Sanskrit words, but there's something called your prakriti and something called your vikriti. And your prakriti is basically how you were born. It's how you came out of your mom. It's how, if you believe in astrology, it's how your birth chart would say what you are. But your prakriti it's your DNA and RNA. So that can't change. And we're always trying to come back. And everybody has a balanced amount of these. So you could be like one person, a very famous Ayurvedic doctor would say you're Vata 3, Pitta 2, Kapha 1. Or, there's different ways to identify, to document this. A lot of it comes through pulse reading. Your vikriti is where you are now. So where you've gone astray. And true healing in Ayurveda is bringing your vikriti back to your prakriti.
Got it.
So, so I usually use the analogy, if I'm taking people's pulses and you feel the deep pulse is how you're born in your prakriti, the surface pulse is your vikriti. And if we're in a lake and the vikriti can drop nice down to the bottom of the lake and it lines up, beautiful. Most people, they get sediment, the lake gets dirty from lifestyle.
This may be a silly question.
No silly questions.
What if my prakriti was kapha and I didn't want to be a lazy person and I ended up becoming a pitta? Would you want to change me back to be a kapha? Or how does that work?
No, I'd want you to be as productive as your life would allow. And no, you don't want to change that way. Like I said, there's no bad here. And there really isn't any bad. It just, you begin to look at people and say, you're more kapha, you're more pitta, you're more vata. But it begins to sink in. And so, no, it's all good. And I wouldn't want to change anybody. You would be healthier if we kept your kapha domination, kapha. So true health is keeping whatever the dominant constitution, the dominant dosha is.
Got it.
Keeping it right. And the other element of Ayurveda is, well, there's lots of them, but is good digestion is key. So we can't really fix anybody if their digestion's whacked. You got to get their digestion right. And there's something too called ama, which I think I told you before, it's a joke. Because it's a bad word in Ayurveda. But ama is this undigested crud, which we develop in our body
Right.
Comes on from bad eating habits, bad life habits. And Ayurveda has a different idea about colon absorption. It really feels the colon absorbs a lot more than just water.
Mm-hmm.
And as the colon gets lined with ama, you get this calcified muck that absorption really gets in trouble. So you want to cleanse. So if you see people and there's ways you could tell people have too much ama, when you begin
Yeah.
to scrape your tongue, if you develop an Ayurvedic routine, and it's just filled with crud.
Okay.
Or
Yeah. Can you explain a little bit more about the tongue scraping?
well, there's an Ayurvedic part of the practice is an Ayurvedic routine, and routine helps balance the vata. So it helps balance the monkey brain a little bit because the vata is bouncy, it's movement, and vata moves. Vata is responsible for about 80% of what goes wrong in our body. So it's like an 80-20 rule.
Okay.
So we always want to balance the vata. And if you don't know what's wrong with somebody, you try to balance the vata. If you can't figure out what constitution they are. And routine, an Ayurvedic routine, it's called dinacharya, is amazing lifestyle change that you would do to help balance the vata, balance everything. And so you wake up in the morning, to make it quick, you splash your face up. So you could start up early if you like to wake up and do your meditation in the morning and that kind of stuff. When you go in the bathroom, you wash your face, you wash your eyes, spill cold water in your face. You scrape your tongue. And you scrape your tongue to get muck that's been coming up through, during your sleep. And the Ayurvedic doctors, Ayurvedic practitioners in India feel that it's more important to scrape your tongue than it is even to brush your teeth, because you want that gook out. And a lot of people brush their tongues because they've learned your breath better. You're kind of reabsorbing all the crud back in. So there's a little horseshoe-shaped thing. You can use a spoon. If I'm traveling, I forget my tongue scraper, I'll just scrape it with a spoon.
Okay.
You just stick your tongue out and use this little horseshoe thing, and a couple times, and you bring it off. And you could also, from that, it'll have different colors, and each constitution has different colors. Vata is like grayish. Pitta is a little bit more pinkish.
Okay.
Kapha is whitish, is more white. So sometimes it's an indication, maybe you ate very pitta producing foods last night, and your pitta is higher and your tongue looks a little redder.
Got it.
You drank beet juice or something. There's other things that can affect it that wouldn't. But tongue scraping is really important part of the Ayurvedic routine. And then you would go, after you scrape your tongue, if you would do a neti pot. So begin to, what are the one they have on television now? Nava. There's one on television where I was always so funny to me, where they had that machine you put in your nose and it flushes everything out.
Oh, I haven't seen that yet.
You haven't seen the commercial for that?
Well, we don't
maybe
have
I'm just,
TV over
I
here,
just turned into it. But there's
funny.
a machine. Lavasage or something. You put this thing in your nose and it basically cleanses your sinus cavities. But there's a way to do it with a neti pot. You just tilt your head, pour in saline solutions, and it, like at 98 degrees, kind of, you're pouring in a solution that's your body's really easy. Put a little bit of salt in it, and it cleans out your sinuses and your breathing passages for a really good reason. Because Ayurveda wants you to breathe better so you have more prana. So it's all about getting more pranayama. So that's another, maybe we'll do a pranayama broadcast. But prana is the life force in Chinese and Indian medicine, a lot of Western cultures. And so it's chi. So some people develop, practice Tai Chi, but and Ayurveda believes that prana is really everything. And it controls your heart. And the prana is what, hopefully we don't watch that many people leave their bodies, die. But you kind of, that energy that leaves the body is the prana.
Okay. The life force. Yeah.
Yeah, it's the life force. So that's why so each one of these things over the years, they've worked out. So if you can breathe better, you can absorb more prana. Even if you don't do a pranayama practice,
Yeah.
you just, breathing
Yeah.
just every day. And we teach people, please breathe through your nose. Your nose is for breathing, and it takes it into your parasympathetic nervous system, which takes so much stress out.
Yeah. 100%. I need to do
That's
that.
a long definition of why.
I need to do that. No, that's great. That's great. Awesome. All right. So part of the routine, this tongue scraping, the neti pot, and then are there certain, I guess, depending on your dosha or your constitution, there might be certain foods you should eat, every day as well.
Yes. So let's say, an easy way sometimes to find out what's going wrong, because we can't see, we're not opening people up. And there used to be Ayurvedic surgeons a long time ago, but I don't think that's taught anymore, even in India.
Okay.
But you know what comes out. So we hope that you move your bowels early in the morning when you wake up, which indicates, according to what we're taught, is good digestion. It's a good indication of good digestion.
Definitely. Same thing in Western medicine too.
So if you're super constipated and you can't move your bowels and you're pooping little hard pellets, it means your vata is really high, because your colon is so dry. It's just
dry. Yeah.
If you're too loose, it's more of a pitta issue. And kapha has kind of nice, beautiful, banana-shaped, good stool.
I call it soft, long snakes. Talk to my patients. Do you have a soft, long snake?
Yeah, that's great. But so, did I answer that right? Wait, what would you start with?
Yeah, the different foods you would eat in the morning.
Oh, the different foods.
Like that.
Yeah.
Yeah.
So yeah, there's a very detailed diet. And I really encourage people to go, Ayurveda is a lifestyle, which is why it hasn't become quite as popular as I would like to see it.
Lifestyles are hard to change.
Lifestyles are hard to change. And I respect that, 100%. And I try my best, and I tell my clients, look, I try to do this the best that I can. I have a lot of pitta, but I love chilies. I shouldn't be eating chilies, especially in the summer, but I do. But there's ways to counteract it. If you're pitta, which is hot, so you want to eat cooling foods, you could drink some aloe juice. You could put cilantro on your food. And a lot of cultures have really figured this out. In Mexican food, it's really spicy. They cover it with cilantro. Cilantro is one of the most cooling, pitta-reducing herbs.
Very interesting.
Or if kapha and vata are pretty strong. They can eat a lot of different foods. Pitta, you have to be a little more careful, because you don't want to heat up too much, and all of a sudden say, oh, I have a pimple, I have this, I have a fever blister, all these different things that pitta aggravates. So there's a whole long, annoying food chart that I usually hand out, and you try your best. And there's a book by this guy, his name, Dr. John Dillard. It's called The 3 Seasons Diet, which kind of talks about this on a more Western way. So it's eating for winter, summer, and fall. And spring, I mean. And he has, different diets he tries to explain it, to have different diets for this.
But he doesn't do the Ayurveda. This is just.
No, he's an Ayurvedic practitioner.
He's an Ayurvedic. Got it. Okay.
Yeah, started as a chiropractor, went to India, and really became a pulse reading specialist in India. And then he became the doctor for when the Nets were in New Jersey. He was
Yeah.
their physio.
Wow.
Yeah,
Very cool.
he's a
Very
good
cool.
guy.
Yeah. Awesome. So it's a lot of, so basically, if you can fix your digestion with eating the appropriate food, spices based on what your dosha is, then you'll be like in good shape. So that's kind of a lot of it's like how the healing of Ayurveda is more through food and diet and things like that. And I guess the routine, like you're saying as well.
Well, there's a ton of herbal supplements. So it's a systematic science, not symptomatic. But we do try, if people are uncomfortable, just like you would want to do for your patients, you want to make them more comfortable. So there
Mm-hmm.
are a ton, the herbology thing is vast. So there's a
Yeah,
vast pharmaceutical program with herbs.
it's amazing. I
Um,
mean, I know in my patients, already even before I was like, learning in the Ayurveda ways and everything, ashwagandha is a huge one. And I think, that's gaining popularity in the,
on
in our
television now.
society. Exactly. And,
I just
I have
bought some
patients
at
and
Costco.
at Costco, it's amazing. Yeah, exactly. Um, and so I think, and I think neem oil we like use for, skin.
So
Is that
neem,
right?
neem is
Yeah.
used for everything.
Okay.
It's an amazing thing. So it's a very, so the more bitter, so it's another talk, but there's how we work with the six tastes, has how we make the diet. So bitter taste lowers pitta. Pitta is
Mm-hmm.
responsible for skin. So you want to just, you can take neem internally or use it externally,
Got it.
and it takes away infections. So a little bit of
Yeah.
neem on a pimple, it's fantastic. And people say, I don't want to
Yeah.
put oil on my skin, but it
Yeah.
works. The neem usually is in a sesame oil base if you use that. And there's neem shampoo now, there's neem in your
Yeah.
toothpaste.
Yep. And it's funny, there was I just noticed on my, buy nothing group on Facebook, somebody was giving away a bottle of neem oil. So I thought
Did
about
you
you.
get it?
I didn't get it, but I thought about you.
Well,
So I thought that was pretty cool.
it's a very strong taste, neem, but a lot of these things you can get in tablets.
Okay.
But
Yeah.
it's really, it's a whole other discussion, but Ayurveda believes that the taste of the herbal supplement makes it so much stronger. So if you could put a dab of neem powder on your tongue when you use neem, it would make it probably 3 or 4 fold.
Okay.
And
Very cool.
ashwagandha, go back to ashwagandha, which is becoming
Yeah.
kind of mainstream.
Yeah.
So not everybody should use ashwagandha. It actually makes you kind of bulk up a little bit, can hold on to some weight in certain
Mm-hmm.
ways. But ashwagandha is a great thing for balancing vata. And it's also
Okay.
great when you become a senior to take to help with your mind. So it's a nervine. So it gives you the energy, but it's kind of has energy. It gives you the energy to figure out what's wrong. That's saying that right. So it gives you the energy to calm your body down.
Okay.
It's a
Very cool.
beautiful compound. It's really, I mean,
Yeah.
it's a beautiful herb.
Yeah. What's your favorite herb? Like what can you not live without?
Um, I mean, I think everybody should be taking turmeric, which also
Mm-hmm.
balances pitta and it lowers inflammation.
Mm-hmm.
And there are some theories that it might even control cell growth, weird cancerous cell growth.
Mm-hmm.
I think turmeric's a beautiful thing. It's why it's a great spice to cook with.
Yeah.
I take something um, every day. It's called a rasayana, which means a restorative for your body. And maybe more
Okay.
as you get older, but there's a compound called Chaiwan Prash that I've spoken to you about. I'm going to bring some to the
Mm-hmm.
office. Um,
Great.
it's a bunch of different things in it, but most of the main ingredient is called amla. And amla is Indian gooseberry. And it's
Okay.
the highest concentrated fruit with vitamin C. And it's a beautiful compound, and it's supposed to, as you get older, I think I might have told you the story behind King Chaiwan. But
Mm-hmm.
it's it was made a long
Mm-hmm.
thousands of years ago, and it's just
I
to keep
remember
you healthy, really good for so it's a great if you're worried about immunity. Now there's another COVID beginning to rear its ugly head, right?
that. Right.
So
Yeah,
it's
we're
good
seeing
to
it.
keep Chaiwan Prash. And I think people ask me, how come my hair never turned gray? I think, I don't know. I've
Yeah.
read things that maybe it's the Chaiwan Prash because I don't know.
Yeah.
Um,
Very, very cool.
my sisters have gray hair. My wife has,
Yeah.
people my age
Yeah.
have hair, but I don't, my hair didn't turn gray.
That's amazing. I'm gonna start taking it. I'm getting my first few.
I mean, it's funny. I mean, my beard's gray, so I don't know how. I should tell
Yeah,
my mom used to ask me, she's how are you not gray? Are you dyeing your hair? You can tell me. I
that's
said,
so
Mom,
funny.
those all those times you come into my house and I'm standing on my head, or I go visit her in her apartment, I'd be doing headstands. And she said,
Yeah,
so that's it. Maybe all the blood going to my head,
all the
but
blood flow. That's great.
so
Well,
food is
maybe.
really important. Food is super important.
I mean, and I'm a very big proponent of also like what we call, in our field, like lifestyle medicine. And it really is, about the lifestyle change and the exercise and the eating healthy overall. The problem is that, like in our society, what I find is that, food is not scientific. Like nutrition is not scientific. You can go to one person and they'll tell you that this is good for you to eat. And you go to another person, they'll tell you this is not good for you to eat. Even,
Yeah.
and you get
Confusing.
very conflicting, and very confusing. So it seems like, this is a lot of like, it's a lot backed by, trials and science and, like all of this. So it's a pretty interesting thing. And I've seen some of the list of foods that you have, and it's insanely healthy, like amazing. And I feel like maybe if some Americans would just start eating this way, it would be amazing because you talk to them about healthy eating now and doing this, and I can do all that I can. They go to nutritionists, they do that, and it's like you get so like different pieces of advice. So this seems, I like the routine. I like that this is what it is for this, and there's no confusing, aspects to it. So that's nice.
I would like to take credit for the food stuff. I can't. This has been passed down. I'm lucky that
Right,
someone passed the knowledge down to me,
right,
and different teachers, and all the overall of the timeline of Ayurveda. We've learned which foods help what.
right.
I mean, I don't want to sound like a jerk, but I think I can help people nutritionally
Yeah, I think
and
you
feel
can.
pretty confident, that I
Yeah,
can. But listen, people love fast food. It's really hard
so
not
bad.
to pass by that Chick-fil-A. I don't, I don't
Oh,
really eat chicken, but people love. My son loves Chick-fil-A. Because
yeah,
you got to taste it. It's the best thing. So we even have
that's
the
funny.
I get the Chick-fil-A sauce that I put
Okay,
tofu and stuff.
that's funny.
But yes,
Yeah, I
it's
know.
hard
It's
to get
it's a
people to break the fast food habit.
it is,
And I
and
think
even
they're
yeah,
kind of addicting. And I think
it's very addicting. And sugar is addicting, and all of that. And yeah, I
the
can go on
sugar's
and on and
poison.
on. Sugar is terrible. Yeah. I usually tell my patients it's, sugar is like a drug. It's like heroin, you get addicted, you need your fix. Once you get it, you feel better. The withdrawal is miserable from sugar, but if you go 2 weeks, without sugar, like you don't crave it as much, just like heroin.
Don't eat
So
anything that's bleached white.
Oh, it's bad.
Well, you know, the other thing too is we try to encourage people to eat as few processed foods as possible.
Right.
And
And
which
that's
is,
hard in our society. It's very hard.
you know, we just made last night, we make peppers and because it's something, so we kind of imitate things we used to eat when we were kids. And we'll take a Beyond Burger and chop it up and cook it with broccoli and pepper and put it over rice, and it's delicious. And I
Yeah.
think Beyond Burgers are pretty tasty, but you really shouldn't eat them every day. But I'm so happy that, you know, became in Beyond came and Impossible Burgers came into being because, you know, that saved a lot of cows. And
Right.
cows are smarter than we think. And too much
Yeah,
cow production is just messing up the you know, the
it
methane.
is. Yeah, that is. I agree with that. I'm more worried, personally as a physician about, the care of cows and, cows can get cancer and cows can get infections and then we eat
Yeah.
those cows that, that's what I worry about. Um,
Well,
but yeah,
because they're in the pens to get, you know, if you
mhm,
let them just be cows,
mhm,
let the chickens just be chickens, we'd have
mhm.
pretty, you know, healthier food, I think.
Yeah, yeah. So, but yeah, I like
Hormones, pumping up
the,
the cows with hormones is really
oh my
nasty.
God. And then you eat that and,
Not
we
me.
wonder why we're all, I mean, I know, yeah. I've actually become vegetarian, more so pescatarian, I would say.
Yeah.
I do fish, but um yeah, it's crazy what's out there in our world. So I think Ayurveda is a really good way for patients and people who are, wanting to get healthy but don't know where to go because there's so much misinformation. And Ayurveda is very regimented and there's no confusing it. It's like
And
this
it's a
is what you're going to
science.
eat. And it's a science behind it. Exactly. And like, this is what your symptoms are. You're feeling tired, you're feeling this, you're like, this is what you're going to eat. Like, and 100%, I'm sure it will, make patients feel better if they stop eating their like, terrible American diet and going to foods like this. So I think it's great.
Well, it's exciting to me to work with you because you're going to have patients, they're going to find things that are wrong. And if we can discuss what's the best, they don't
Mm-hmm.
have to do all Ayurveda, you know,
Mm-hmm.
and you know, some people need blood pressure medication. Ayurveda
Mm-hmm.
doesn't, you know, I'm learning some things that are helping with blood pressure, but it's not a perfect thing. And
Yeah.
times you need medicine and certain you need an MD for especially for diagnostic stuff that's
Right.
much better than, I mean, an Ayurvedic practitioner, we learn a lot about trying to read the symptoms, but I can't say that I can, you know, get every symptom. I mean, you know, blood work, we talked about it before, shows certain things. If your sugar's high, I could tell symptomatically sometimes,
Yeah.
but
Yeah.
you can tell how high somebody's sugar is and how we would have to bring it down. And we could do it
Right.
with diet. You're saying, you know, if it, I don't want to generalize to a community, but you know,
Yeah.
Indian and Asian, a lot of Asian communities ate a ton of rice.
Mm-hmm.
You know,
Yeah.
my Arabic teacher said to me, he said, we're too old now. We can't
Yeah.
eat rice
Yeah.
every meal.
Yeah. No, I mean, and honestly, I'm not generalizing either, but I talk to a lot of my Indian patient population and we we look at their sugars and they're really high. And what do we say? Stop eating the white rice and stop eating, and they do and they change their diet and we can help better control their sugars, but it's very, carb friendly and um yeah, I
Yeah,
agree.
carbs are good. I love French fries.
I don't know what I would do without bread.
No, I love carbs,
So,
and you know, sugar tastes good, and sugar's kapha. And everything we do is kind of to break that sugar down
mm,
into six tastes. And
mhm,
kapha tastes good,
mhm,
you know.
mhm.
Even I mean,
Yes.
but it's not. Look, carbs are tasty. I mean, I try to eat only whole wheat pasta, but
Yeah,
I miss semolina. You know,
I know. I know. It is like you said though, it's a lifestyle change. And I think having you and I there, and, with this system of medicine and this practice, patients have access to us, and they have, they can call, they can text, they can ask questions, whereas you can't do it in a traditional, form of medicine. You don't have that time with your doctor to kind of do this. So, between the two of us, I think, we can work on diet and, their constitution, and seeing what's right for them and what they could be doing and changing, and, having close follow-up. So, I think it's a win-win for the patients.
I'm thrilled. I mean,
Yeah.
I wrote to you, my neighbor right down the street,
Yeah.
she was complaining about something medically, and she just came back from the south of France and had this great trip and was eating great. And I said, and I told her about you. I said, if you want to see a physician that's not going to
Yeah.
rush you out the door,
Yeah.
go talk to Lily, and she's
Yeah.
nice.
Oh, you're so kind. Thank you.
And yeah, I hope, I think the word will get out.
Hmm. I
And
do too.
my family's in California, a lot of
Yeah.
them,
Yeah.
and they've been using concierge medical care forever.
Yeah.
And I don't think people here are used to that different kind of system. You're not using your insurance, but you're paying a monthly and you're getting care. I
Yeah.
mean, my sisters in California, well, this isn't new. We've been
Yeah.
doing this for 20 years, but
The problem is that I think a lot more doctors are going to be doing this type of method, because insurance is really cracking down on what can and can't be done in the visits. And patients come and they have a list of their issues, and they have, they're coming for their wellness visit, and insurance won't let you do multiple problem visits and a wellness visit and all that. And so, the patients get upset. The doctors are upset because they're, not able to care for patients how they should be. And, the patient then has to take time off again from work, and, get care for their kids, or, like, rearrange their schedule in their life. So, like, you come, and then, you come back and you have your list, and the doctor says, okay, well, we only have time for like 5 of these issues, and then we'll come back, another time, and we'll do the other 5. And, if you probably had the time, you could look at everything as a whole and realize that they're all connected. But instead, you're like being treated for this, and this, and then you're coming back and you're being treated for this, and this, when you really could just be treated for this. Um,
well,
so I think there's
to be
a lot
clear
of
though,
issues.
with
Yeah.
Ayurveda, they teach
Yeah.
us treat what's screaming out the loudest and then move on.
Yeah.
So, I mean,
Got it.
so I guess
Yeah.
it's a little, but
Yeah. But this is just, I mean, most of them, I think, in this sense, like, is, I mean, you have headaches, you have joint pain, you have this, and it's like, oh, well, are you drinking enough water? Are you exercising? Are you doing, and it's like, you can't get to all of that. And then we were like, here's your medicine for your headaches. Like, here's your NSAIDs and your ibuprofen for this. But, like, you could actually, if you spend the time and talk to the patients, there's probably non-medicinal ways that you could help them too, but you can't get into that, in the traditional way. So,
I give
and
people, there's an oil called Mahanarayan. I've talked to you about it.
yeah.
That I learned about a long time ago. It's an analgesic. It's an herbal analgesic that just takes away pain, and it's fascinating to me. How
Hmm.
sports injuries and different injuries and knee problems and stuff.
Yeah.
And so instead of killing your liver
Yeah.
with,
Or your
with
kidneys or
your
something. Yeah,
kidneys,
exactly. Yeah.
you could rub
Yeah.
some
No.
nice oil on. It might, the smell takes a little maybe getting used to or something, but, and
Yeah.
my wife used to say, oh, you're staining the sheets again with that red.
Oh no. So get dark colored sheets, advise the patients that. But yeah, and I think there's always a time and a place for, those modalities. But, a lot of times it's not needed, and we tend to overprescribe because of that. So
It's
but
money.
yeah.
It's the money
Hmm.
system, that the hospital became such a huge
And
economic,
insurance companies,
yeah.
I mean, doctors aren't getting paid much anymore, but insurance companies are getting paid a lot. So we can go into that, the whole nother topic.
But
But
that's been progressively happening for 30 years, I think.
I know, I know. Um, but yeah, so I think what we have is going to be great, and hopefully people catch on to this and we
They
go
will,
from there. Yeah.
one step at a time, like you said.
Yeah, exactly. Baby steps.
Well, we'll continue this. I want to make more. I like to do this as often as I think it would be really fun to expand, what we're talking about and go a little
Let's do it.
deeper into each, you know,
Yeah.
pick thyroid one week. We could pick the liver. We could pick blood pressure and the difference. We could talk about how you want to try and treat it and
Yeah.
what we could do together.
Right. That sounds great. That sounds great.
And we always can put in yoga because that's really healing part too.
I know. Oh, my love for Ashtanga yoga started with you. So
Oh,
yes. So, and yeah, we'll have some yoga. We're having yoga sessions and, info sessions about Ayurveda. And you want to talk a little bit, just mention the Ayurveda curious and, in case we.
well, Ayurvedic, so I'm the president of the Pennsylvania Ayurvedic Medical Association, which we're working for. It was really formed to try and get a Health Freedom Act because we're not really allowed. I mean, I have you,
Mhm,
which keeps me clean, kind of, but I'm not. There's no real legal thing about practicing Ayurveda.
mhm,
And Chinese medicine finally got their health freedom, safe harbor stuff, so they can practice legally. So we formed a group through the national. There's a big national group, the National Ayurvedic Medical Association, and to raise money to try and lobbying and all this stuff. We have to hire lobbyists. It gets expensive. So October 29th, we're having an event at a place called Yoga Secrets in Kennett Square that's going to talk about Ayurveda, and I have a couple very accomplished Ayurvedic professionals coming to present. And then you and I are doing an Ayurveda Curious event on
mhm.
August 6th, I think. August.
August 1st, I want to say. We'll
Oh,
look it
well,
up.
we're going to put it up on the website, but we're going to
Yeah.
have another Zoom call. It'll kind of be like this,
Hmm.
probably. And then we're going to do an Ayurvedic yoga class to show people because um, if you want to lower your pitta, you would do more twists. You're going to work on it. It's going to keep you cooler this time of the
Hmm.
year. So it's yoga that there was a great teacher in India called, his name was Krishnamacharya, which is where Ashtanga and Iyengar yoga came from. So,
Mm.
because he taught Tabi Joyce and he taught Mr. Iyengar, and they went out and spread this gospel.
Yeah.
But he was, his gurus go way, way back. And he really thought about individualized practice because years ago, there weren't yoga classes that were 50 people in a room or
Hmm.
30 people. They
Right.
didn't have yoga mats. It was just different.
Right.
And
Yeah.
he would look at you and try to give you a practice for you.
That's great.
So, yeah, so Ayurvedic yoga kind of does that.
Yeah.
Then, you know what? Well, I love to talk about meditation and pranayama and stuff. And
Yeah. We'll meet next week. We can, delve deep into that.
okay,
All right.
namaste. Oh,
Namaste.
thank you.
Namaste.